and this is Ashley, my handler, and Marco, our demonstration horse. Today I'm going to be talking about the methods of restraint. The three types of restraint for a horse are chemical, physical, and verbal. Verbal would be to say things like whoa, or to use a stern voice or growl if your horse is misbehaving. It's not appropriate to scream or use profanities when around your horse, as it could startle them or be disruptive to those around you. Chemical restraints would be things such as ditomidine or acepromazine that you would use when your horse is having stitches or some sort of medical procedure or body clipping and they're upset by the procedure. Physical restraints or manual restraints are what we're going to be discussing today. Our most basic method of restraint for manual restraints is what we have on Marco right now. That is a halter and a lead rope. The halter needs to be fitting properly, which means it's not too low with the noseband down on the sensitive structures of his nose. You don't want to damage the cartilage or bone. You don't want it so high that the metal is touching his cheekbones, as that could be uncomfortable for him. And anytime you're working with a horse, you want to have your halter and lead rope on. Sometimes you need to have a little more control, however. If you're walking your horse to turnout and he's very frisky or startled by something, you might want to have a chain shank. Here we have our chain shank, which is a long chain attached to a lead rope. To apply it, you go diagonally in with the clip through the halter, go to the other side, down through the ring, and clip up to the upper ring on the side of the halter. If you notice how I have passed the chain and looped it over the noseband, that is so that the chain is not pressed directly against his nose, as that could be uncomfortable or even painful and damaging. It is also to prevent the chain from slipping or falling down over the horse's nose. When you're holding the lead rope with the chain shank, you do not want to jerk or have sharp movements. You want to maintain a gentle, steady pressure. You also never want to tie a horse when he has a chain shank on. To remove it, you come back to the other side, unclip it, gently pass it back through the rings, and let it slide out while holding both ends. If you're not careful, you could hit him with the chain or the clip, and that would be dangerous. Our next manual restraint is a lip chain or a lip twine. What we're going to do is a lip chain. You do not want to lead a horse in a lip chain. You want to maintain steady, even, gentle pressure, never jerking, as it could be damaging to the horse's gums. To apply the lip chain, you slip the clip through the ring on the side of the halter, go to the other side, up through the other ring. Since I'm not looping it over the halter noseband, you need to be careful not to let it just drop down as you're applying it. Then you clip to the top ring again, pass back to the other side. Then I'm going to take the chain in my hand, almost like I would a bit, but I do not want to slip it into the horse's mouth. You're just going to drop it down, lift his lip, get the chain on his gum, and pull down. To remove it, you're going to slip your hand under and just let it come off. You don't want to just let it drop, or it could hit his teeth, and that would be painful. Our next method of restraint is a rope twitch. Sometimes these also could be a chain twitch, or would have a loop of chain, but we have a rope. The rope could be a little more gentle, and some people feel that the chain twitches can pinch. So to apply the twitch, you want to stick your hand through the loop, leaving one finger out so that it does not slip over your wrist. I'm going to leave my pinky finger out to prevent slipping. I'm always going to be careful to hold onto the handle of the twitch so that it does not swing and hit somebody, myself, my handler, or the horse. I'm going to put the handle under my arm so that I can twist it easily and quickly without it swinging anywhere else. I'm going to grab his lip. I want to make sure to have a big chunk, and then slip my hand out as I'm twisting the twitch on. Going to get it on tight enough that I can let go, and then I'm going to untwist and remove. When using a twitch, you do not want to leave it on for too long. It can end up being very dangerous. When the twitch is applied for up to about 5 minutes, the twitch acts as a distraction. From 5 to 10 minutes, the twitch acts as some sort of analgesia. It releases chemicals in the horse as his pain response, so it actually kind of numbs the lip for a while. At around 10 minutes or any longer, and the twitch can become dangerous as the horse enters the blow phase, which is when the analgesia stops and the horse is flooded with pain. You do not want to leave the twitch on to that point, or you could be harmed, or your handler. The twitch is important to put on quickly and efficiently, and have all your supplies ready for whatever procedure you're going to be performing beforehand. When performing manual restraints, it's important to be safe. You should always have a handler and pay attention to your timing. When you are going to use a method of restraint, you want to have all your supplies that you're going to be needing ready beforehand. If you're going to be clipping, get the clippers ready before you use your method of restraint. I want to have my handler on the same side of the horse as me, so that if there's a problem, she can pull on the lead rope to send his hindquarters away. The shoulder roll is another method of restraint. This is a short-term method of restraint, as it can be hard to hold the actual position with your hand for more than a minute or two. You're going to be actually grabbing the skin with your hand and rolling it forward. This kind of freezes the horse temporarily in position. It doesn't actually stop him from moving, it just is a distraction. So if it's hard to grab the skin right here, I can have my handler turn his head towards me a little bit, and that can loosen the skin. So I'm going to grab, get a nice grab, and roll away from me, and he leans away and freezes. The shoulder roll can be good to use as a distraction during an injection. It's also important when performing the shoulder roll to stand facing the front end of your horse so that you could see his head if he were to turn and try to bite you. Another method of restraint is the leg lift. This is best used when someone is trying to perform some sort of procedure on an opposite leg. If someone is trying to bandage and the horse keeps lifting his leg or trying to clip it, it helps oftentimes to lift another leg. You never want to lift a hind leg when doing this, as the horse can kick you. If someone were performing a procedure on the hind right leg, you would want to lift the front right leg, since it is difficult for the horse to stand on two legs on the same side, but is easy for them to stand on a diagonal pair. If you were working on a front leg, you would simply lift the opposite front leg. This leg lift is performed the same way you would pick up the leg as if you were picking his hoof, and then with an extra lifting action. So I'm going to run my hand down his leg, pick it up, keeping my feet out of the way, grabbing another hand on his cannon bone, and if need be, lifting higher. You want to set the leg down gently, not just let it fall. I have now talked to you about the different types of restraints. It's important to remember that when using manual restraints, you're not physically stopping your horse from doing anything. You're simply causing a distraction. It's important to perform these methods of restraint in a calm yet confident manner. We are practicing these methods on a very calm horse today, but when you actually need to use them, chances are your horse will not be calm.